To finish off our discussion about the central nervous system, we're looking into reflexes a little bit. Now, yes, reflexes are usually utilizing part of the peripheral nervous system, but they also tie into the central nervous system. So we'll start a discussion about them here a little bit. Now, a reflex is a rapid automated response. You can't really think, oh, I need a reflex now. The reflex just happens. Now, these reflexes are always the same response. Per person, I'll add in there. Because think about it, if a baseball is coming at you. One person might have a reflex to catch it. The other person's reflex might be to duck. But that a lot of times goes back to what your past experiences are, what your training is. But the person that's going to catch it will always catch it. The person that's going to duck is always going to duck. So it's the same reaction will happen every time for the same person. Now, from person to person, the reactions might be different. But within the same person, the same reaction will occur. But there has to be some stimulation. That baseball flying at you, that's a stimulation. Could be a pin in your hand. You pull back because that was stimulation of pain. But every reflex starts with an external or it could be an internal stimulation. So the idea is this stimulation will start the whole process of a reflex arc. And it is quick and it is involuntary. It might use voluntary muscles, but the response is involuntary. All right, so there's 5 main steps in a reflex arc. Now, depending on what you're looking at graphic-wise, you might notice they say 6 or 7, but there's 5 main points that can kind of just extrapolate an extra part here or there. So first off, you have to have a receptor, something that receives the stimulus. Baseball flying at you, your receptor is your eye, the visual cue. Pin in the hand, receptor is the skin. You're feeling the pain in the skin. So that receptor is going to receive the stimulus. You then have the sensory neuron. That sensory neuron will carry the information from the receptor into the central nervous system. So that's an afferent pathway, bringing information into the central nervous system. You then have the integration center, spine or brain, central nervous system. One of the 2 pieces of the central nervous system will determine what needs to happen, what the reaction should be. It then has the motor output, the motor neuron. The motor neuron will carry the efferent information away from the central nervous system out to an effector. The effector is wherever's going to make the change. In the case of the baseball coming at you, that could be the hand coming up to catch. Could be the knees buckling to duck. If it's the pin in the hand, it could be the arm pulling back away from the pain you feel. But whatever the effector is, it's going to make a change. And the last piece is the effector. It's whatever makes the change. The effector is whatever receives that motor output and then changes the situation. Could be a muscle causing contraction. Could be a gland causing secretion. But wherever the effector is, it's meant to react to what the initial stimulus was. To look at it this way, the pin in the skin is the initial stimulus. You have the receptor in the skin, which is right here. You have that receptor. It then sends the sensory neuron information in. Now that sensory neuron is bringing the information in. This would be the dorsal root ganglion here, into the dorsal horn. From there, you're now in the integration center, spinal cord or brain. The inner neuron is going to help make a decision on what needs to happen and bridge the gap between the sensory and motor. Here in the ventral horn, you're going to have the motor output leaving out the ventral roots, and that's heading down to the effector, in this case, a muscle, which would pull your hand away from the pin. So 5 main steps in a reflex arc. Now, that's the basic idea. Obviously, it can get a little more complex when you start putting it into actual terms, what's going on. So here we're looking at the patellar reflex. You can see that the doctor is hitting the patellar ligament, the leg is going up. So initially, what happens is, the first thing that occurs is the muscle gets stretched. So this muscle is being pulled out just a little bit. I mean, that's a little tiny bit. But when the hammer hits that ligament, it pulls the muscle a little bit. When that muscle reacts, that muscle spindle is activated. The muscle spindle sends a sensory impulse up towards the spinal cord. It's on the sensory neuron. You then have that sensory neuron interfacing in the spinal cord, and that is going to be basically determining what needs to happen. But notice, there are two different outputs now. We have a red and a green. So in this case, the spinal cord determined we need a stimulatory and an inhibitory signal. We're going to send this green stimulatory signal out to this muscle. That's going to contract. But we're going to send an inhibitory signal down here. That muscle is going to relax. Because think about it. If your leg goes up, so at the knee is going to basically extend. Quadriceps contract, hamstrings better relax. Otherwise, that leg's not going up. So you have to make sure you allow for the antagonist group, in this case, the hamstrings, to relax or be inhibited. Now that's one single pathway to one leg. There are even more complex reactions than this, but this is just trying to show you what one reflex arc can look like. So the same basic 5 principles, just applying it to how it's actually working in the body. So reflex arcs, a little bit of process of how they start and what they're doing.